the station that's on your side. This is Channel 7 News Good Morning Arkansas.
Hey, welcome back. Dr. Laura Wilson of Sherwood Family Medical Center is here. We're talking strep throat. We've talked flu enough, don't you think? I mean, we've had so many flu stories, and for good reason. It is something we still need to be cautious about, and it is still a big problem. That's why schools are closing. But strep throat still, I mean, this is the time of year. I know you're probably seeing plenty of cases. I know you want to explain today what exactly it is and what's the difference between that and something viral.
And we see strep year-round. It's funny, I don't think I've ever talked about it, and it's a good classic pediatric diagnosis. So I think we needed to do this. So what is strep throat? Strep throat is an infection of the mouth caused by group A strep bacteria. Symptoms usually include fever and sore throat. A lot of times I'll also see kids with headache or maybe even nausea and vomiting. The diagnosis does require a test. So people say, oh, I can tell by looking. No, you can't. You need to do a test. And typically we do a rapid. That rapid should be backed up with a culture if it's negative. And unfortunately, most of our local urgent cares don't do that backup culture, which is actually considered essential and part of a gold standard. So if you do go to a quick clinic, ask, are you going to do a culture? Because that's an important part of the diagnosis. And lastly, it's treated with antibiotics.
It's bacterial infection.
That's right.
So
I love it. Good job, Chris.
How does this, well, I've learned a lot in the last couple of years with two young ones, and a lot of parents out there do as well. It's kind of a learn as you go, and you don't remember when you were a kid getting some of these things like we all probably did. And so you wonder, okay, is this symptom this, is this that, and how they can mimic a viral symptom at some point too, which is why it can be confusing. And
that's exactly why I wanted to bring up what is not strep. So strep, thankfully for your babies, not common under age 2 or 3. I have seen it, but not common. Strep does not cause runny nose, cough, hoarseness, mouth ulcers. As a matter of fact, the recommendations say don't even test those kids.
Really?
Because that's not going to be strep.
That'd be a tough test. Oh my goodness.
Strep, again, fever, sore throat, headache, vomiting, but not nasal drainage, all that kind of stuff. And strep is not, again, as I mentioned, a visual diagnosis. It does require a test.
Okay, it's good because those under 2 have a tough time telling you their throat hurts. You know, that's another part of it too, where, hey, my throat hurts. If your kid's under 2 and can't explain it, it can be frustrating if you don't know what is actually causing their pain. Now, oral antibiotics, is that the best treatment for this?
Well, it can be oral or a shot. Of course, the kids don't want the shot, but the shot's one and done. It's a shot of bicillin, which is a form of long-acting penicillin, or we treat with oral antibiotics. The classic is a penicillin for 10 days. Penicillin liquid tastes pretty nasty, so we end up going to amoxicillin, which is the pink bubblegum stuff, which most kids will take pretty well. The good news is strep can make you feel awful, but with antibiotics you feel better in just a day or 2.
What kind of complications can arise from strep?
Well, the one I see pretty commonly is scarlet fever, and parents' eyes open big. Scarlet fever.
It sounds terrible.
It does. It sounds like it's from the 1800s.
It really does, yes. The scarlet letter.
Guess what scarlet fever is?
A fever?
It's strep with a rash.
Oh, okay.
So it's a rash, a fine sandpaper rash on the trunk, kind of concentrates in the armpit, in the groin. And I see it maybe, I don't know, 5% of the kids with strep will get scarlet fever. It's still just treated with antibiotics. It's, again, a strep rash. But the more serious complication is rheumatic fever. And that can happen in an untreated strep. It includes a complication in the heart that's a chronic, lifelong problem. So really, strep could be a self-limiting disease, meaning, you know what, your body could get over it. But untreated, you increase the risk for rheumatic fever.
And if someone has kids experiencing any of the symptoms you talked about, how long should they wait or not wait to contact their doctor to ask about getting a test?
With most minor illnesses in kids, I think you're okay to give it a couple days if the mom, the dad has a comfort level with their sick symptoms, because sometimes it will declare itself. It may start, the kid just says, oh, my throat hurts, and then the next day they get a bad runny nose and a cough, which again puts it more likely in a viral category. But if we do have a couple days of persistent fever, sore throat, feeling bad, that kid probably needs to come in and get a swab.
Okay, and if you need to get a swab, you can go see Dr. Laura Wilson, of course, Sherwood Family Medical Center. They'll take great care of you up there. The information is on your screen. Hopefully seeing some flu cases go down. I know that's still something that, I mean, is the clinic pretty bad up there right now?
It's pretty bad.
Yeah, I know we've had some school closures that we've talked about on Daybreak and throughout the newscast. And I guess the best reminder, not just for strep, but for flu and any illness. Wash, wash, wash.
Yes,
Don't,
for sure.
Kids touching their face all the time. How do you,
don't share drinks, wash your hands, all that, yes.
Okay, all right. Stop sharing for now. Wait to do that until after flu season.
Actually.
Don't share right now. It's not safe to share, but take care of your kids the best you can. The best you can do that is go see a doctor if you feel like they need care. Thank you so much for stopping by. As always, Dr. Wilson.